Okay. Okay, so how is everybody for Friday of a week 3? If everybody could turn their cameras on, I would appreciate that. How's everybody doing?
Finally getting into the routine, that's what I can
Okay,
say.
yeah, it takes a couple of weeks for sure.
Mhm.
How are your other classes going?
Starting to all come together, at least for me. It's
Good,
been
good.
rough. I'm sure I can speak for
Yeah,
everybody.
this is a very challenging term, very challenging. Like I said, in week 1, it requires just over the top time
Mhm.
management skills, organizational skills, especially time management. Um, so, uh, um, okay, so week 3. So today we're going to be taking our quiz 2, and then we'll be reviewing the quiz. And then um, we'll go through additional details on each concept. And then at the end, the last 15 minutes of class, 20 minutes of class, we're going to do a case study. And the case study supports the concepts of migrant health and rural health. So I sent the case study to you last weekend in your week 3 announcement. So you'll have to have that pulled up when we get to the case study. Okay. And then I'll break you up into 3 groups. Room 1 will answer question 1 on the case study. Room 2 answer question 2. Room 3 answer question 3. There's 3 questions on the case study. So you get together as a group in a breakout room and talk about the case study and what the answer is for your room. How's that? Okay. And then I'll be next week, obviously, is next week is exam week. And so over the weekend, you'll be getting a couple of announcements from me. Um, Let me just make Dr. Captero, 1 second, co-host here. Um, Welcome, Dr. Capteros. Looks like you had great attendance in your concept review. It's fantastic. We'll talk about that in just a minute. Um, so you'll get a couple announcements over the weekend. One will be an exam 1 prep, just all the guidelines for taking exams. It's available to download an hour before, what you can't have, and no calculators. It's just a pretty standard announcement, but it goes through the information and guidelines for exam taking. This past week, I did open the practice exam in ExamSoft with some directions. Highly suggest it's a very quick ExamSoft practice exam. The goal of it is to test the compatibility with the devices you're using. It's a technology check to make sure everything's compatible so that we don't run into any issues next Friday when we take the exam. So, has anybody taken that yet?
I did it already.
And how was it, Amanda?
Fast and easy, same thing I've done for the last year.
Exactly, exactly. But if you switch devices or you go term to term, or there can always be a hiccup. Okay, so just because you didn't have any issues last term, it's being proactive to make sure there are no issues this term with whatever devices and software you're using. Okay, so I would encourage
Yes.
you to take all that. It's open. This week, I also sent out group assignments. I did my best. I mean, the numbers don't always work out that everybody in every group is from the same campus. Okay, but I did my best. I can't have, 6 students in one group and 2 students in another just to accommodate everybody being the same campus. I mean, students tell me that occasionally they'll get together on campus to work on their part, but technically this is an online class, so it really is an online assignment. All right, so even if you're not with students, everybody's not from your same campus, it still requires the online collaboration and communication. Okay.
Um,
Um,
I do have one question. The
sure,
the thing that
Jessica.
was in the thing that was in the module today, the like window
Window.
thing where you have to try, it's like vulnerable populations and you have to like look out your window and like take a survey.
Oh, do a windshield survey?
Yeah.
Okay.
Like, can you explain that a little bit more?
So a windshield survey for community nursing is exactly looking out your windshield, right? If you're driving around, if you're on a bus, if you're on your bike, if you're taking a walk, if you're driving around in your car, windshield survey is a fancy way of saying that's how you begin your assessment of the community, right? As you're driving around, you're observing. What are you observing for? You're observing for, is the community clean? Is it not clean? Does it have resources? Does it have parks? Does it have a lot of people walking around? Does it look like a friendly community? That's a windshield assessment, right? And when you're asked to do community assessments, that's what we call it, windshield survey. Kind of driving around, observing what things look like. Is it an older community, newer community? All the
Okay,
things that.
so sorry.
Go ahead, Jessica.
So is that separate from, because like I don't want to choose, like I do live in a fairly like nice neighborhood, but I wanted to choose like a different vulnerable. So is that like a separate thing from vulnerable population paper?
Well, even I'm sure you
Or
have
am I trying
vulnerable.
to,
I'm sure you have vulnerable populations in your community, right?
I guess.
I would assume you do. I mean, people with chronic diseases, children, elderly,
Sure. Okay.
right?
Right.
I mean, so
I'll figure it out.
every one of us, regardless of what community we live in, we all have vulnerable populations, right? Some
Okay.
of us may have more homeless populations. Some of us may have adolescent pregnancy issues. Some of us, um, I mean, every community has vulnerable populations. Does that
Okay.
help?
Yep.
Okay. All right. Awesome. What else was I going to tell you guys?
Question, Professor Marble. I
Yeah,
noticed Professor Ford also has a review tonight as well at 6 o'clock. I think as well as you do too at the same time.
I don't think so. It's
Yeah.
just me. She had hers Tuesday night.
But I got another email saying or another announcement that she was doing another one tonight.
Oh,
I
okay.
also saw that.
It was in addition to the one from Sunday night. I sent out the announcement about an additional one Sunday night. Is that what you guys are talking about?
No, this one's for Professor Ford. It said that she was doing another one
Okay.
as well.
Why don't
So I was just
why don't you forward that message to me, Amanda? All right, because I want to make sure if that's the case that I post that in my announcements for my students or the rest of our students. So I'll be doing one
yes.
after. Oh, go ahead.
Yeah, because I pulled it up. She will be doing another exam one review on Friday at 6 p.m. Eastern. She hopes to see you there then. So I don't know. This was actually Professor K posted this one on October 17th at 10:20 a.m.
Professor K or Professor Ford?
Professor K.
Okay.
Hold
I'll
it.
have
What
to
is it? What does it say? Is it a quiz, a concept review, or
hang on.
exam review?
Can somebody mute themselves? Or I don't know where the background noise is coming from, but I can't hear anybody talking.
It just says exam one review with Professor Ford, but then it says students below is the link to Professor Ford's exam one review from Tuesday evening. She will be doing another exam one review on Friday at 6 p.m. Eastern.
That's me. So
Oh,
that's
she
me.
just
Yeah.
didn't specify. Okay. She just said
Okay,
she
that's
is
me.
continuing
So
Professor
it sounds
Ford.
like she posted her recording and then probably indicated there's another one Friday at 6, which is
Okay.
me. Okay. And then we posted another announcement yesterday that Dr. K is and since next weekend is exam week, there are not the concept reviews before every class because it's an exam week. So Dr. K has offered to do an additional exam one review using the resource of a Jeopardy game. And that's
Okay.
what was sent to you. So you have a third opportunity to attend an exam one review in a different format, which is awesome. And then part of that announcement, also, Dr. K put together some flashcards and a quiz, exam one review quiz. So you have lots of different extra resources Does that make sense, Amanda?
Yeah, I'm sorry. It was just the way it was just, I think, written. It was just,
Okay.
it kind of, it was talking about Professor Ford, and then it just said she will be doing another. So it just, the way I read it just was wrong, I guess, and the way I
So,
interpreted it. So,
okay. All right. So you all received Professor Ford's recording from her review from Tuesday night. Tonight, I will send out all the sections will have a copy of my review from tonight if you can't attend. And then Dr. K will be recording her review Sunday night, and we'll get that out Sunday night. Because I have Monday and Tuesday classes, so we'll be taking the exam. So I'd like to get that out Sunday night. So you have 3 different reviews. Okay. Okay. Let's go ahead. If you tried to open the quizzes prior to 4 o'clock, you're going to have to refresh that. Okay. Because they didn't open until 4 o'clock. And since it's a timed quiz, it's for 15 minutes. Let's see, it's 4:11. It closes at 4:30. It's a 15-minute quiz, so you should have plenty of time to get it done. I have put the access code in the chat for everybody. It is my last name, Marvel. So if everybody could, number one, make sure they're on mute, please. And number two, go ahead and get the quiz started. I'm going to mute myself during these 15 minutes. We will come back at 4:30. So if you, number one, you have to stay on camera. Okay. And once you're done and submitted, you can go off camera, but I need everybody back by 4:30. Okay. And if there are any questions about the quiz, please put them in the chat. Okay. Don't come off mute. All right. All right. Go ahead and get started. Okay, it looks like everybody is done. You could all start to come back on camera. That would be great. How'd you do this week? I saw a lot of improved scores. What'd you do differently than last week?
Went to some reviews.
Exactly. Good job, Asia. What else did other students do to help prepare for this week's quiz? I saw that Dr. K had 16 students come to the concept review the hour before class. And of course, that's voluntary. But I'm really very impressed with 16 students attending that concept review. Did you find it helpful?
Yes.
She is very helpful.
Yes, yes, yes.
Especially
Awesome.
when it's fresh in your brain prior to before.
Exactly. All right. We haven't been doing
And
those.
even that, she just explains it way better. Like she
Fant-
makes us really think out the concept and things. Like she goes into depth with explaining it.
That's fantastic. And so I am grateful. I am grateful to have Dr. K on board with us this term. And Dr. K is the one who came up with, hey, let me do a concept recording prior to each class. And so she did one Monday before our classes Monday. She did one Tuesday. She did one Wednesday before Professor Ford's evening class. She did one today, and she's going to do one tonight for Professor Ford's evening class. So she's doing a concept review for all the different sections. And as you saw from my our announcements about that, anybody can attend any review. So you guys have the benefit of being Friday students, and you can attend a Monday or a Tuesday or a Wednesday, right? You have the schedule. Okay, they're not just restricted to the students who are about to go into class. They're open to everybody anytime. Okay. And then we added a couple of days ago, we added a Sunday night one for the students who couldn't get to any of them, whether it's before their class or any of the other ones. So we've now added a Sunday evening one at 8 p.m. and I sent out an announcement about that. Okay, so even if you're a Friday student and you know for whatever reason you're not going to be able to get to the hour before your class or even the hour before the other sections, come to the Sunday night one. Okay, and also about those concept reviews. So really you have one Sunday, Monday, Tuesday, Wednesday, and Friday before class. That's a lot of opportunities. Okay. Now we will not be having those during exam weeks, obviously, because we're not going to be covering concepts during exam week. And so that's why we've switched out the Sunday one this weekend for an exam review. Okay. And does anybody have any questions about that? Really great additional resource for you guys. All right, let's take a look at the quiz. What'd you think about the rationales? Helpful? Okay. Well, the rationales, like I said last week, they're meant to introduce and talk about each concept. A lot of the rationales,
Take them Jordans off. Your dad's not
Somebody
cussing me out because you're out there playing
sit.
fucking football.
Oh, God, excuse me. If somebody could mute themselves, or let me figure out who I need to mute. Okay. Thank you. Okay. All right, let me share my screen. Well done, everybody, it looks like the great majority of you improved your score. So well done. Well done. Okay, can everybody see my screen? Yes, no,
Yes, yes,
Thank
yeah.
you. Thank you. Okay. All right. So this first question talks about rural communities. Before we even get to the question, all right, I'm going to scroll down here to the rationale. When you were reading and preparing and studying about rural communities, what do we know about rural communities? What did you learn? What are rural communities?
They have
People
limited
who live far
resources.
out,
Limited resources. What else?
Lack
They're
of
in more
transportation.
poverty.
There are more poverty is definitely increased in the rural communities.
Their chronic illnesses or more.
Chronic
yeah, they're more
illness.
accessible to those.
Say that one again. I heard chronic illnesses. What was after that?
They're
Lack of
more
transportation.
susceptible to those illnesses.
Yep. Lack of Yep. Yep. Okay. We know that rural populations, rural adults, are less likely to prioritize their health and engage in preventative activities. They're more likely to smoke, have higher rates of alcohol, substance abuse, obesity. They're much less likely to engage in screenings, wellness visits for all those potential chronic diseases, do blood pressure checks, cholesterol checks, pap smears. Okay. Rural populations have lots of challenges. Insurance is another one. Okay, remember that question last week about underinsured and uninsured? A lot of people in the rural populations don't have insurance or they're underinsured. So, as we talked about last week, the access becomes challenging. So, hence, they're much less likely to prioritize their health and engage in preventative activities. I heard somebody say transportation. Transportation is a big issue because when you live in rural communities, hopefully you learned there are not a lot of healthcare services in rural communities. Typically, you may have a family physician, a general physician, or a nurse practitioner, and they see everybody, right? But if you need specialty care in the rural setting, it's most likely you're going to have to travel. Okay, travel to a bigger city, and that's what our case study is about. Okay, travel to a big city for neurology, orthopedics, gastroenterology, pediatricians, OBs. Those are not typically in the rural settings. Okay. So the other thing that goes along with rural settings, the reason why what I'm trying to get at is a lot of rural populations live in poverty. Okay. A lot of the occupations in the rural community are not high paying jobs that have insurance, right? They may be hourly paying jobs, daily paying jobs, like the migrant farm workers. And so if you get sick, they're less likely to want to take the day off and go travel to the cities for appointments until things get bad enough that they have to. Because what's the issue? They don't get paid. Okay. So, what should the home health nurse anticipate about clients that live in the rural community? We already answered that. They will be they will be much more likely to have complex chronic illnesses for what we just talked about. Okay. We know that B is incorrect. Most of them will have employer provided insurance. They won't. Okay. They will be less likely to have environmental chemical exposures. Actually, that's the opposite. They're more likely to have chemical exposures, pesticide exposures. We'll talk about that in another rationale. Most of them will have adequate access to physicians. No, they won't. Okay. So A is the only logical answer when we're talking about rural populations as a whole. Anybody have any questions about that particular question? Okay, here's our first primary, secondary, tertiary question. We didn't have any on the quiz last week, but this quiz and going forward on the rest of the quizzes, there are primary, secondary, tertiary questions. There's several primary, secondary, tertiary questions on the exam. And there's several in the HESI. So we have to have a good understanding of that. So that's why in this particular rationale, I know I pulled this up last week to share with you, but it wasn't in a rationale. So I wanted to give I wanted to give this refresher to you. So this rationale discusses what a primary, secondary, tertiary. We know primary P is prevention, trying to prevent something before it even occurs. Whether we're trying to prevent an illness, an accident, an injury, a disease, a condition, trying to prevent something before it happens. Secondary, screening. We are screening for risk. So we are trying to early identify and early intervene in a risk we've identified. All right. So as to potentially reverse the course, prevent complications. Okay. So screening, pap smears, mammograms, colonoscopy, behavioral health risks, suicidal risks, substance abuse risk, obesity risk, screening. Okay. We want to early identify risk because we want to try and reverse that so it doesn't get into tertiary. And then tertiary T is treatment. Okay, we are trying to treat or manage something. So something has to have had to occur. An accident's had to occur, an illness, an injury, a condition, a new diagnosis. Okay, so we're trying to manage the disease, trying to reduce the symptoms, trying to improve the quality of life. Okay, so medications are a good example of tertiary because they're taking medications for something. Low sodium diet, maybe they have hypertension. Checking blood glucose in a diabetic, they have diabetes. Somebody with hypertension, maybe we're trying to help them, educate them on how to maybe lose weight if they're obese to help manage their hypertension. Okay, and I'll repeat what I said last week because you have questions coming up about these. Education is at all of these three levels. Okay, don't just think that education is at the primary level. Certainly at the primary level, we're educating to prevent. At the secondary level, we've identified risk, and so we're educating to try and reverse course. Okay, or early detection. We're trying to educate, maybe somebody's at risk for obesity. We're trying to educate them on how not to let that go any further. Maybe talking about the long-term effects of obesity across the lifespan. Okay, and then education obviously happens at the tertiary level as well, right? Because they have something, whatever it is, TBI, new diagnosis, we're educating them how to manage what has happened, whatever that might be. Okay? So, primary prevention is the question. So the nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate? There's only one answer here that is primary, and that is B. Provide information on minimizing excessive sun exposure. So when we look at a question, we try and figure out what's the population or who is the population, individual, family, community, and what's the environment. So from the question, we can pull out, we're talking about the rural community. We know that in a rural community, lots of rural communities live in agriculture or have jobs that are outside, right? So an appropriate intervention would be providing information on minimizing excessive sun exposure, trying to prevent something before it happens. What is A?
Secondary.
Yeah, screening, right? Pap smear. What is C?
Treatment.
Treatment.
Yeah, they have diabetes, right? What is D?
Secondary.
Secondary.
Yeah, we're screening. Okay. Does everybody understand those?
Mm-hmm.
It's a good review of all three of them. Okay. Okay, migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, cough. Which nursing intervention is appropriate? So let's go back to the question. Our population is the migrant farm worker, and we need to understand the risks of migrant farm workers. One of the biggest risks for the migrant farm workers is chemical exposure, pesticide exposure. Okay, and as you saw in your readings, we have different kinds of pesticide exposure. We have acute and we have chronic. So in this question, these are particular symptoms related to acute. So when we say acute, those exposures are now. When we say chronic, those exposures are over time. Okay, so B is the correct answer. So bilateral eye irritation is more than all these symptoms. Bilateral eye irritation, throat irritation, cough. That's more than conjunctivitis. Okay, we certainly wouldn't be requesting an order for an antihistamine because we don't know what's going on. We don't diagnose and we don't treat. So C would be inappropriate. Okay, and these are not symptoms of TB. Okay, these are symptoms of acute pesticide exposure, and that's what the rationale is. I need you to understand that because there's some questions about this on the exam. Okay, given scenarios, can you identify if that's acute or chronic? Okay, so acute, memory loss, difficulty concentrating, mood changes, abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation, headache, confusion, twitching muscles. They could have some or all of these. Those are all acute. Okay, but let's say a migrant farmer has been working on the farm for an extended period of time and has had extended exposure. Chronic looks much different. Potentially cancer, blood disorders, neurological problems. Maybe a pregnant mom working on the farm. Chronic exposure could cause birth defects. Okay, infertility, sterility, liver damage. Chronic exposure could potentially have Parkinson's and Parkinson's-like symptoms. Okay, so that's the difference. Acute, the here and the now, chronic, over time. Make sense? Okay, during a home visit, the nurse notes that a migrant farm worker family is living in a small house with several other families. Which nursing assessment is a priority? There's a lot of good information in this question. Okay, we know the population is the migrant farm worker family. We know the environment is a small house with several families living in there. Based on our reading about migrant farm workers, what do we know? What is the potential risk of living in the rural community on the farms with a small house with several other families? What are we at risk for?
TB.
TB's one. TB, the three that come to mind, and these are in your rationale: TB, GI issues, and hepatitis. Okay, so let's look at the rationale. When they arrive at a farm, they may find that housing is not available or that it is substandard. It may have lack of sanitation, structural defects, mold, lead, broken appliances, maybe lack of climate control. Some of our migrant farm workers' families, if they bring their family along, are living in cars or tents. When housing is available, it tends to be overcrowded, as many as 50 per house, which contributes to risks of TB, GI issues, and hepatitis. Older housing exposes residents to lead. Okay, maybe the housing is located next to the fields where there's high concentrations of pesticides that threaten the health of the families. Okay, so with that population, where they're living, the correct answer is we would want to do a TB symptom screening questionnaire. Okay, and it's not that some of the other answers wouldn't be something we would think about doing. Okay, we're not going to go for a history of GI reflux disease right off the bat, but what is the other important word in this question?
Priority.
Priority. Okay, so this is a good example of a question that if another answer looks like it could be correct, I think I said this last week, you're going to have to go back and look at the question. Did you miss a particular word, like a priority? Okay, since we know migrants living in close quarters are increased for TB, the priority would be to do the symptom screening questionnaire. Okay. Okay, this introduces the concept of poverty. Okay, so which statement reflects the impact of income on health outcomes? Well, let's just think about poverty in general before we even look at the question, before we even read the rationale. What do you think what are some impacts on poverty to a particular individual, family, community? What are some impacts? What might you see, observe?
More chronic illnesses.
Chronic illnesses. Okay, what else?
Maybe more drug usage.
Maybe more
Lack of
unemployment.
education.
What about unemployment, maybe? What about lack of or challenging access to healthcare? Be challenging access to schools, decent schools, maybe limited access to proper nutrition. What else? Think of the people in your community where you currently live that are potentially living in poverty. What additional challenges do they face? Maybe increase in mental illness, increased risk for substance abuse, increased risk for violence, maybe child abuse, domestic abuse. There's lots of impacts on individuals, families, and communities that are in poverty. Okay, so I'm not sure, I think Asia might have said it, but the correct answer is low income increases the risk of chronic illness. Of course it does. Because why? Maybe limited access to healthcare. Okay, kind of like the rural population, right? Lack of access to healthcare means they're not going to prioritize their preventative needs. And by the time we see them, they may be much more advanced in whatever's going on. Okay. So A is incorrect. Low income guarantees access to Medicaid. No, you have to be at a certain Medicaid is finance what am I trying to say? You have to qualify based on
Below
your
the federal poverty line.
Yeah, that's next. That's our next question. But you don't automatically you have to be eligible. Okay, you have to go through the assessment to see if you meet the eligibility needs of Medicaid. Okay, high income reduces the attendance to wellness visits. No, actually, it increases the attendance at wellness visits, correct? And then the last one, high income does not improve health outcomes. Yes, it does. Because they have access. They have most likely have insurance, most likely have access, and most likely will focus on their preventative care or their secondary care, right? The screenings, the prevention. So let's look at the rationale for a minute. I'm not sure who's putting, Dr. K, can you check the messages in the chat, please? Because I have to stop sharing my screen and go back all the way back to answer the chat messages. Okay, so let's look at the rationale. Poverty leads to chronic stress, leads to mental health issues, higher rates of chronic illnesses, higher infant morbidity and mortality, shorter life expectancy, more complex health problems. and maybe increased disability related to the chronic illnesses. Certainly leads to higher rates of hospitalizations, because if you're not seeing these clients in the primary or secondary stages, and you're seeing them at the tertiary level, of course that's going to increase hospitalizations, right? We know that complex health problems lead to high healthcare expenditures. It's much more expensive to take care of people with complex, or even not even complex, but chronic illnesses and complex chronic illnesses, right? Which can certainly have an adverse effect on their financial stability, especially if they're already living in poverty. Okay, so poverty, the best way, and this will come up in my additional notes, but I want to mention it. The most important way to assess the health of an individual, a family, a community is the financial stability. Okay, if you're living in poverty, it affects everything. Everything. Okay, so as you go out in the community, do community assessments, the financial stability of the individual, the family, the community is really going to have a high impact on the health. Okay? What should the nurse anticipate for a family living just above the poverty line? Okay, even if you live just above the poverty line, you're going to lose eligibility. Just a teeny bit above. You're going to lose eligibility to a lot of resources, right? I see a few of you shaking your head. Okay, so if you're living just above the poverty line and you've lost additional resources that you may have had, or that you just simply didn't qualify for, A is the correct answer, right? There's going to be increased vulnerability because of your access to fewer community resources, right? Improved health outcomes compared to those in poverty. That's not correct. Reduced vulnerability due to employer-provided insurance. Remember, it's going to be increased vulnerability. Okay? Let's look at, there's some more in this rationale about poverty. And this is about federally qualifying. Poverty is defined by the federal government and the various state governments for purposes of program qualification and tracking. Then it goes through some figures, but they're from 21. I believe I took this rationale from your reading, right? Still, let's look at the last sentence here. Those just above the poverty line still desperately need the resources, but no longer qualify, which puts them in a vulnerable position. Okay. Which client is at the highest risk for adverse health outcomes? Okay, what's the important word in this question? Yeah, what's the important word?
Highest risk.
Highest. It's not that every one of these don't have some risk. Okay, they all do. But we know that young kids are at the highest risks for the effects of poverty for many reasons. We've talked about a few questions earlier. Maybe lack of adequate nutrition, maybe poor brain development from that, exposure to environmental risks, toxins, maybe exposure to trauma, abuse, lower quality daycare. We know that kids have more chronic diseases, more nutritional deficiencies, more growth and development issues, maybe increased risk of developmental delays, maybe higher elevated levels of blood lead levels if they're living in older, more rundown communities or housing. Kids have more infections, and they are usually stuck in the poverty cycle themselves due to decreased opportunities. So the highest risk in this group is that 15-month-old, not only because of the age, but also there's no medical history. We don't know about previous diagnosis, any injuries, any illnesses, immunizations, but also that they're 15 months. It's not that the elderly client, the 68-year-old, is not vulnerable with type 2 diabetes, but the question is asking who is the highest risk. And children are at the highest risk for the effects of poverty. They can't advocate for themselves, right? Okay, now another poverty question with regards to impoverished adolescent, impoverished teen. Okay, we know, and this was in your readings, that poor teens are more likely to have below average academic skills, and that they are 3 times more likely to drop out of school. Okay, they're at higher risk for teen pregnancy. And if they become pregnant, they're at even higher risk to suffer issues during their pregnancy, maybe due to lack of prenatal care. They're at risk for low birth weight babies, premature babies, babies with birth defects. Okay, so we would expect from an impoverished, meaning living in poverty, teen, that the correct answer is increased risk for dropping out of school. A is the opposite. There's an increased risk of unintended pregnancy. An impoverished teen, with regards to C, is not going to have excellent use of adaptive coping mechanisms. Those coping mechanisms are going to be challenged, right? They're not going to have excellent use of those coping. And then they're not going to have improved attendance at extracurricular activities. It's actually going to be decreased attendance. Okay, I just went through that rationale. Again, another priority question. Which client is the highest risk for homelessness? Why is B the correct answer? What does B have that the others don't? Or what is the issue with B lacking that the others have? Let me ask it that way.
He doesn't have support.
Right. This is a veteran living with PTSD, which is in itself is high risk, but then lives alone. The others have support. Okay, so the rationale is a good introduction or a good supplement to your reading about homelessness and more information about the homelessness concept. Okay, so we know that homelessness includes those people living on the streets, but it also includes those staying with friends or relatives, maybe staying in temporary shelters, staying in institutions temporarily. And the whole premise of this is they have nowhere to be discharged to. They do not have a permanent address when they get out of the shelter, when they get out of the friend's house or the relative's house. They don't have a address to go to. And so we know some people are intermittently homeless, meaning they go in and out. All right, so it is hard to accurately estimate the number of homeless individuals. In your readings in the module this week about homelessness, they attempt to give lots of figures, and those are estimates. Okay, we know that homeless people are exposed to the elements, whether it's freezing cold or brutally hot. Okay, they're outside for the most part. They're usually living in crowded and unsanitary living conditions, suffer from malnutrition, lack of sleep, chronic stress. They're much more likely to abuse substances, have mental illnesses, experience certain types of communicable infectious conditions, TB, skin infestations, chronic illnesses, and they're at increased risk of being victims of crime. Okay, trauma is a major cause of death and disability with regards to the homeless population. Maybe gunshot wounds, the risk of violence is increased. Maybe gunshot wounds, suffering from gunshot wounds, stab wounds, head trauma, Mental illness is huge. Increase in suicide attempts or carrying through a suicide. And I find this incredible. The average life expectancy of a homeless individual is 44. That's very young, as opposed to 78. Okay, the nurse working in an outreach clinic at a homeless shelter. Which clients should be prioritized? So again, our population is a homeless individual. The environment is a homeless shelter. And the question is asking what needs to be prioritized. Okay, it's not that all 4 of these clients are pardon me? It's not that all 4 of these. Could somebody please mute? I'm not sure who needs to mute. Thank you. It's not that all 4 of these clients don't have to be assessed. They do. Okay, but it's asking which clients should be prioritized. Because of the environment, the homeless shelter, because of the population, the homelessness, we know they're at increase for developing TB. We know that A are some early signs of potential TB, complaining of night sweats and unexplained weight loss. So it is a priority to assess whether there's any kind of a TB outbreak going on, okay, which would take down the whole shelter. It's not that a worsening foot ulcer with purulent drainage, obviously those are signs of infection, that client needs to be seen. Same with frequent urination, constant hunger and thirst, definitely needs to be assessed. But as far as prioritization, it's the client who is exhibiting symptoms of potential TB that has to be dealt with first. Okay. I'm going to pull up our PowerPoint, and I want to cover a few more things about each concept. Any questions about the quiz? Okay, these are obviously the concepts we cover today. We start to address these in the quiz questions. The migrant farm worker, the rural populations, the homelessness, and the poverty. Okay, so we talked a bit about migrant farm workers already. Now I'm going to ask you some questions. Who are the rural, migratory, and seasonal agricultural workers? Who are they? Where do they come from? How long do they stay? What are their risks? What are the common health concerns specific to the migrant farm worker? These were all outlined in your readings in the module. And what are some barriers preventing migrant farm workers from receiving health care and healthcare coverage? What did you learn from your readings and from the quiz and the rationales? Who are these people?
Some of them are immigrants.
Mm-hmm. A large majority of them are immigrants.
Mm-hmm.
Yes. What else did you learn about them? Do they stay for periods of time? Do they move around a lot? What do they do?
Seasonal.
Pardon me?
They move around. Yeah, they move around a lot.
They move around
And
a
a
lot.
lot of them might stay in like one house.
Mm-hmm. Mm-hmm. What are some of their barriers? It was
Language.
Yeah, we haven't talked about that yet.
Their job might
Language.
not
Pardon me?
offer. Their jobs might not offer health care. More than likely, they don't.
Yeah. The one thing we didn't address was language barrier.
Mm-hmm.
This is often a very common problem, right? If there's a language barrier and nobody can help them navigate healthcare, how do they know what's available to them? Right? How do they know if there's any migrant clinics? We have what it's called the Migrant Health Act. Okay, that was established a while back. And these are primary and supplemental health services that migrants are available to migrants when they come in to work seasonally. Okay, they're located, I think there's about 154 health centers in 42 states. How do you communicate to them that this is available if there's a language barrier? Very, very challenging. Okay, it's wonderful to have all these migrant centers, but we have to be able to accurately provide the information that they have that as a resource, right? Migrants are often, we talked about, at risk for chronic diseases. What if they go to one of these migrant health clinics and they've been diagnosed with high blood pressure or diabetes, and then they leave, then they don't come back for 6 months? It's hard for the healthcare system to keep up with all their movement and making sure that their chronic diseases are getting treated. They're also at risk for dental issues, obesity, depression, mental health. We talked about that. Think about the stress of being a migrant farm worker and all the things that go along with that. Think of the potential mental health issues that come along with that. We know the kids, we talked about kids, are very much at risk if they are brought with the migrant farm workers. Let's say they bring the whole family and the kids are working on the farms. In addition, the kids are disrupted. We already talked about risk for malnutrition, risk for increased infection, dental issues. We don't know their immunization status. Think about their disruption of school. Okay, their social lives are upside down, right, because of the constant mobility, right? Farm workers, we talked about some of these with the following health risks. We talked about pesticide exposure, heat and sun exposure. Think about one of the biggest risks for farm workers is accidents. Okay, from the machinery, from the tools. So occupational injuries is actually the biggest concern with rural and migrant populations. Okay, they're also at risk for infectious diseases, musculoskeletal injuries. Let's say they're lifting 12 to 15 hours a day and carrying and lifting and bending. All right, they're at risk for the respiratory illnesses because of all those chemical exposures, skin disorders from this chemical exposures, eye injuries. And then, as we said, high rates of depression, neurological problems such as Parkinson's. Let's see, rural. We consider rural living, hang on, rural populations. Common characteristics. What are some common characteristics of the rural population? What are they?
They live far out, kind of like country.
They're very tight-knit communities, right? Everybody knows what's going on. There's not a lot of anonymity, which is one of the reasons why a lot of people in the rural populations don't like to come forward with sensitive things. Okay, if there's only one practitioner in the county or the town, right, they're less likely to go and report child abuse or report domestic violence or report substance abuse or overdoses. Okay, one of the biggest barriers in rural towns is lack of anonymity, which is why a lot of them will not come forward for specific sensitive issues until it's kind of at a crisis point and they need to get some health care. Okay. It is estimated rural populations tend to be populated with people younger than 18 and people over 65. They tend to have fewer years of formal education and far fewer college degrees. Here's some pretty interesting statistics. It's estimated that 25% of people that live in rural areas live in or near the poverty line. 25%. And that equates to close to 40% of kids that live in rural communities live in poverty. That's a lot. We talked about fewer residents having inadequate insurance. Well, we talked about residents less likely to prioritize their health care and engage in preventative activities. When they get sick, when rural individuals get sick, one of the big factors and big challenges, they have more difficulty maintaining their independence. Why do you think that is? Let's say they get sick and they have a chronic disease. Why are they more likely to not be able to maintain their independence? What do you think factors into that?
They let the disease go too long and they can't get better from it. Like if
Yep.
it's diabetes, they might end up needing like an amputation or something like that.
Exactly. They may have issues with transportation and can't get to their specialty visits, right? Lack of public transportation. And then certainly lack of services. We talked about that. Lack of services within that rural community. For high-risk rural jobs, okay? Forestry, mining, marine-related fields, and agriculture, right? So these industries have we kind of talked about this in general, but have the most highest risk for accidents and injuries due to their working conditions, the machinery they're using. They're much more at risk for vehicular accidents, for trauma, for long-term exposure to chemicals, so cancer. Okay. We talked about barriers to health access in the rural areas. We talked about healthcare insurance coverage, which is very challenging in the rural areas. How does low, poor health literacy affect this population? Well, we started talking about that, right? When we say poor health literacy or low literacy, that's not being condescending. Okay? It's simply a fact that in the rural areas, populations may not comprehend all of the healthcare resources or limited healthcare resources that are available to them, where to go seek these healthcare services if they need additional follow-up. Okay, low literacy, non-English speaking plays a dramatic factor in that. Okay, what kinds of healthcare services may be difficult to access in rural areas? We talked about that. The specialties. You know, if there's a high risk of mental illness and substance abuse, you're not going to find rehab centers in rural areas. You're not going to find detoxification centers. You're not going to find mental health institutions. They're just not there. People have to travel for those. And then we talked about specialty care. Homelessness. Okay, let's talk about the initial approach. Okay. And this could apply to any of the vulnerable populations, but for purposes of this week, we're talking about the initial approach to caring for a homeless population. What do you think? What should the initial approach be? What do we have to do? And what are we trying to establish? Well, this starts the discussion of cultural competence. Okay. One of the first things that we need to do, and really this is in all of your profession of nursing, okay, but for purposes of this class, we'll talk about it for community health. We need to do an assessment of ourselves, right? We need to be able to think about, do we have any biases, prejudices, judgments against certain populations? Teen pregnancy, people with mental health issues, homelessness, people live in poverty, maybe the LGBT community. In order for us to provide culturally competent care and sensitive, appropriate healthcare, we need to do our own self-assessment. Does everybody know what I mean when I say that? It's going to be hard to establish trust with the homeless population if you already have preconceived judgments or notions, right? And one of the first things we need to do with any vulnerable population, including the homeless, our goal is to establish a trusting relationship so that they will open up to us and we will be able to help them. Okay? We need to respect the individuality of every person, right? We know that many factors contribute to homelessness. Everybody has a story of how they got there. And usually they want to share it. That comes after the trust has been established. Okay, it's often easy to stereotype this particular population, but often we're going to be wrong about what their story is, right? If we're making assumptions. Okay, let them tell their story. Let them tell you who they are and how they got there. All of that factors in how you can help them, guide them on a path forward. And that's where resiliency comes in. Remember, we talked about resiliency last week in one of our quiz rationales? How do you help this population build resiliency? What are some risk factors for homelessness? What do you think? Unemployment? Disability? What are some other risk factors?
Drugs and alcohol.
Drugs and alcohol? Absolutely. What are some other
Maybe
risk factors?
illnesses that prevent them from working.
Mhm. Diagnoses, disabilities.
Parents who have substance abuse problems.
Yeah, exactly. I mean, many of you probably know, or maybe even have family members, or you yourselves may have been homeless at one point. Okay, everybody has a path for how they got there. Our job in the community is to help lift them up out of this, right? Whether it's a homeless family, homeless individual, homeless friend, homeless relative, what resources, and on your reading page in your module about homelessness, at the bottom, there's a whole list of homeless resources. Did you see that? The reading page on homelessness is excellent in your module this week. Some common clinical and medical conditions. Well, they're high risk for chronic diseases, so cardiovascular disease, dual diagnosis. Maybe they have mental health illnesses with alcohol, with substance abuse. Maybe they have cardiovascular disease with mental health issues. That's what dual diagnosis means. A lot of homeless people have cognitive disorders, a history of TBIs. We talked about this slide in one of our rationales. High risk for injuries and violence, preventative health issues. They don't seek preventative care. As a homeless individual does not seek preventative health issues. In fact, where did homeless people end up seeking their care? Where's the most common place they seek their care?
Emergency rooms.
And why is that an issue? Two reasons. Because they're sick. They're really sick now, right? If they end up in the ER, right? We didn't go through that primary and secondary stage. And number two, caring for clients in the ER, especially homeless, because it may come with lots of comorbidities, is very expensive, right? High risk for infectious diseases, STDs, skin foot problems, exposure related conditions. We talked about that, and I mentioned the resources. Okay. So I think I covered all my extra notes in addition to the rationale. Do you have a better understanding of these four concepts? I mean, this is community nursing, right? This is public health nursing, vulnerable populations, right? And if you're working in a rural community, you may be working with migrant farm workers. And you're certainly going to be working with the rural populations. And we all have homeless people in our communities. We all have people that live in poverty. So as a community nurse, as you're out there, this is what you're going to be dealing with. Okay. All right. I'm going to break you up into, actually, I'm going to break you up into 6 breakout rooms. Okay. And if you're in rooms 1 or 4, I want you to answer question 1. Okay. If you're in rooms 2 or 5, I want you to answer question 2. And if you're in room 3 or 6, I want you to answer question 3. So you're going to have to pull up that case study. Okay. So I'm going to create my breakout rooms, and then I'm going to assign you all a breakout room. You're going to get an invitation, join your breakout room, and then we'll stay in there for maybe 5, 7 minutes, 8 minutes, and then I'll close the breakout rooms, and you'll all come back here, and we'll talk about it. Okay. Anybody have any questions?
Wait, what were the rooms again and the questions? I just want to make sure I know.
1 and 4,
Mhm.
answer question 1. 2 and 5, answer question 2.
All right.
3 and 6, answer question 3.
Thank you.
Yeah, sure. Of course. Bear with me. A big class. Okay. So while I'm doing this, pull
I
up
was trying to
your
open up the case study and it's not allowing me to have access to it.
It's doing the same for me.
It said access denied
is that for everybody?
Where is the case study?
in week 3 announcements.
Week
On
3
mine
announce-
too.
Week 3 announcements.
Yeah, it says you don't have access to this view, this resource. We've let your instructor know to review this link as soon as possible.
Okay, then let's do it differently then. Okay. Let me pull up the case study and we'll do it as a group. Let's see. Thanks for letting me know that.
You're welcome.
Okay. All right, let me share my screen. This is actually a good case study. It's a migrant rural population case study. And when I send you guys the recording for the class, I'm going to send you this version of the case study. You didn't get this version. You just got the case study. This is now the case study with answers and rationales. Okay, and you'll get that. So this is a good study point for the exam as well. Here's some questions to ponder for class. All right. Compare and contrast definitions of rural and urban. Okay, describe the health status of rural populations. We talked about that. Discuss access to services of rural underserved populations. We addressed that. Define what a migrant farm worker is. Discuss common health problems in their families. What barriers? We talked about that. We didn't talk about describe the susceptibility to pandemics such as COVID. Explain the nursing role for serving people. We started to talk about that. They're considered vulnerable populations. So the approaches to what we talked about of how to work with vulnerable populations, establishing trust. So let's look at the case study. Okay, so we have a nurse, Janelle, who's a nurse. She works for the public health department, and she's assigned to a rural health clinic. The clinic serves a largely Hispanic population with many migrant farm workers who are primarily male. So the town she serves is approximately 45 miles away from the nearest densely populated city. It is located within a farm residency. Many of the large farms have housing quarters known to be occupied by undocumented workers. The farms are situated within the fields of grapevines and peach orchards. Okay, so here's our first question. Let's do it as a group. As a public health nurse working in the rural community, what are some of the professional challenges that the nurse may encounter? What do
See,
you think?
the lack of resources.
Chronic illnesses.
Okay, so let's look at the answer. Okay, the answer is C. Lack of resources with other professionals to interact with. Right? Remember, if you're working in the rural community, you may be it. There's not a lot of coworkers. There's not a lot of resources. Okay? She is going to, it's asking, what is a challenge? Diversity of clinical experiences. She's going to get that. Diversity of clinical experiences. Okay? Close relationships with clients. That's where that lack of anonymity comes in, not only for the clients, but also of the healthcare workers. If you're the only one working there, everybody knows you, right? And then greater autonomy of practice. She will have that. She's going to have a lot of autonomy because she's the only one, right? Let's look at the rationale. It supports what we talked about today. Some of the challenges of rural practice. So you and I, all of us working in the rural setting, some of the challenges of rural practice and professional isolation, limited opportunities for CEUs, lack of other kinds of healthcare personnel or professionals with whom you can interact, heavy workloads, the ability to function well in several clinical areas, because remember, you could be caring for anybody across the lifespan, right? Kids all the way up to the elderly. And then potentially restricted social life, right? Many nurses value the close relationships with clients and coworkers, along with the diverse clinical experiences that evolve from caring for clients of all ages who have a variety of health problems, caring for clients for long periods of time. When we talked about this rationale, I think it was my Tuesday class, there was a student who lived in a rural community, and one of her relatives, I think it might have been her uncle, was the physician, the family physician in that rural community. And in her family, she said there were 4 generations in her family that were that family practitioner in the community. That's pretty amazing. And that's not unusual, right? So maybe her uncle, her great uncle, her great whoever, but the care in the community came from her family for 4 generations. Okay. All right. She's working primarily with Mexican immigrants. What cultural health beliefs and practices is she expected to encounter when dealing with this population? So I know going into this case study, you probably don't have a good knowledge of, or you may, from your experiences in working, have a good knowledge of the cultural values, beliefs, practices of the Mexican population. This is a good rationale about the Mexican population. And this again talks about cultural competency, whether we're in a rural or urban setting, whichever culture we are caring for, we need to have some knowledge about that culture, right? We don't need to memorize everything about every culture, but if we're not sure about we have Vietnamese culture, Russian culture, Mexican culture, what do we do? How do we learn about that culture?
A lot of times when I run into families that are like that, when I work in the hospital, I'll ask them like
Ask
what
them.
are their like
Exactly.
their things that they do as like a family, like their
Yeah.
beliefs and whatnot, or what they want done.
Because ultimately our goal is to incorporate as many of their values and practices and preferences and beliefs into the healthcare plan for the client and their family, right? We want to incorporate as much as we can. And we can usually incorporate most of it. I mean, there may be some things that we just can't do. But the whole goal is to learn about different cultures. I've been working on cultural competence for 40 years. Okay, I've been a nurse 40 years now, and I consider myself culturally competent. I don't know everything about every culture, but I certainly have taken care of lots of clients, lots of kids in schools, worked with lots of parents from different cultures. And if you don't know, you got to learn. right? To be culturally competent, you got to learn about cultures. Okay, so this particular rationale goes through, in particular, the Mexican. So you can read through that because I'm going to send it to you. So now she has a client, Jose. He's a 48-year-old man. I'm question 3 here. 48-year-old man who works in the grape fields. He works for 12 to 13 hours a day. He's responsible for picking, packing, moving, and get everything ready to be picked up for delivery. What are some health concerns for this particular gentleman? Okay, this select all that apply. But based on the answer, right? Doesn't say he's working on a tractor, so A's out of the question, right? Green tobacco sickness, that's not an issue. C, D, and E. So can you see how he may suffer from chronic neck and back pain? Can you
Because he's
see
picking, he could be bending and he's moving heavy
exactly?
crates, and then he's in the sun, which
Yeah.
could give you cancer and it also gives him dust and chemicals in the air.
Big dust and chemicals, exactly. So C, D, and E, because the physical demands of harvesting crops 12 to 14 hours a day take their toll on the musculoskeletal system, obviously. Back and neck pain were the most common. Okay. And then second was applying the pesticides, right? So may have eye problems related to dust and chemicals. Okay. And then skin cancer from all the exposure. Okay. So this is an excellent rationale as well. So I'm going to, I will send that to you guys when I send you the lecture recording so that you have the case study with the correct answers with the rationales. Okay. I want to be mindful of time. We only have a couple more minutes left. Does anybody have any questions? Has this been helpful to learn more about these different concepts? Do you feel like you have a good grasp on them?
You mind if I add something?
Oh, sure, absolutely.
Okay, with the homeless population, keep in mind Maslow's hierarchy of needs. I know in gerontology, a lot of you were in my class. Remember how we learned if you can't meet your physiological needs, you can't meet your safety needs? So many homeless people are unsafe because they don't have enough nutrition, safe housing, all of those basic physiological needs. So they can't go to the next tier, which is safety, which means they can't go to the next tier, which is belonging to someone, feeling like they're safe, like they belong to someone. So keep that in mind if you're dealing with homeless people. Before you judge them, think about Maslow's hierarchy of needs, because none of us could survive, could get to that second tier and be safe without the first tier being met. Okay?
Excellent point. Thank you for sharing.
Thanks. I just wanted to share that.
Yeah, that's awesome. Okay, so I'm going to stop the recording.